Good morning, ladies and gentlemen. Good morning, especially to all the viewing and listening public, both here and in the diaspora, those of you who are preparing even to visit us for this Carnival season. It should come as no surprise to you that we're here, the Ministry of Health, Wellness, and Social Services, as we approach the culmination of one of the most festive times of year for us in Dominica. Our press briefing today will focus on Carnival and, of course, health and safety precautions. We have the pleasure of having with us Dr. Shalodin Ahmed, who is the national epidemiologist. We also have Emmeline Matthew, the matron at the Dominica China Friendship Hospital, and Dr. Laura Esprey, Chief Medical Officer Acting. Of course, as always, I know it's been a while, but as always, we begin our presentation with Dr. Ahmed. He'll give us, of course, the statistics in Dominica.
Thank you, Ms. Harry. Greetings to the Honorable Minister for Health, Wellness and Social Services, Honorable Kasani Laville, the Permanent Secretary of the Ministry of Health, Wellness and Social Services, Mrs. Leticia Lestrade-Wyke, the Chief Medical Officer, Dr. Laura Esprey, Matron, Dominica China Friendship Hospital, Ms. Emmeline Matthew, our moderator, Ms. Shina Hari, and all media and listeners. I am privileged to deliver the COVID-19 summary report today. COVID-19 pandemic began in late 2019. The first cases were reported in Wuhan, China in December 2019, and it quickly spread to a global pandemic. The World Health Organization declared COVID-19 a pandemic on March 11, 2020. On the 20th of March 2020, the initial instance of COVID-19 was identified in Dominica. Since then, the government of Dominica has taken various measures to contain the spread of the virus and protect its citizens. These efforts have been reflected in the data as seen in the following statistics. This slide shows the transmission pattern of COVID-19 cases in Dominica was sporadic and cluster transmission all through 2020 and most part of 2021. The arrival of waves caused the transmission pattern to change to community transmission, which lasted until August 2022, when it returned to a sporadic pattern. This slide demonstrates that the Ministry of Health in Dominica was successful in reducing the spread of COVID-19 through measures that flatten the growth of the outbreak. We carried out gene sequencing on samples collected during two peak periods and discovered two variants of concern, the Delta variant from August 2021 to January 2022, and the Omicron variant in May 2022. Of the documented cases, 53% were female, representing a slightly higher proportion compared to the male population. Regarding the distribution of cases by age group, 63% of the cases occurred in 20 to 64-year age group, a demographic that is slightly mobile, highly mobile. However, as illustrated in this slide, the age-specific rate is relatively uniform across all age groups. Vaccine status. The majority, about 56% of the cases, were among individuals who were not vaccinated. Although the majority of the cases had symptoms, it is important to note that at some point, only individuals with symptoms were screened. It is noteworthy that the majority of individuals with symptoms were not vaccinated. COVID-19 related deaths and characteristics. A COVID-19 death is defined for surveillance purposes as a death resulting from a clinically compatible illness in a confirmed COVID-19 case. Our first death occurred in August 2021. During the period from August 2021 to January 2023, there were 78 deaths with a case fatality rate of 0.5%. The highest number of deaths occurred in September 2021. This case fatality rate of 0.5% is the second lowest in the Caribbean region and the lowest among the OECS countries. As seen in this slide, showing the distribution of cases by gender, the largest number of fatalities were among females. Distribution of deaths by age groups, the majority of deaths, around 70%, were among the individual aged 70 and above, based on the age distribution analysis. A child aged 13 with cerebral palsy, a congenital disorder, died from COVID-19 as well. Among those who died from COVID-19, 74% did not have a vaccine. And of the 78 individuals who died, 88% had underlying medical conditions. Most of the underlying medical conditions were hypertension and diabetes. In summary, the total number of cases stands at 15,848. Daily new cases for the past 7 days on average, 0.2, translates into 1 case per week. COVID-19 related hospitalization for the past week, 0. Daily positivity rate for the past 7 days on average, 2.5%. Overall positivity rate, 6.9%. Total deaths, 78. New death, 0. Case fatality rate, 0.49%. New recoveries, 2. Total active case this week, 1. Our fully vaccinated population, 44%. Our partially vaccinated population, 3.3%. And booster dose administered in 5.8% of our population. With this, I thank you for your attention.
And we continue to express our gratitude to Dr. Ahmed and his team for their continued monitoring and surveillance of the impact of COVID-19 here in Dominica. Of course, one of the things, the highlights of the presentation would be that our fatality rate remains one of the lowest, the second lowest in the Caribbean and the lowest in the OECS. And of course, we'd like to commend you, the general public, for your vigilance thus far. There's still more to be done, and you will hear from our other presenters about that. So we welcome next to the podium Emmeline Matthew, who is the matron at the Dominica China Friendship Hospital.
Good morning to the listening and viewing public. I am Emmeline Matthew, matron at the Dominica China Friendship Hospital, where one of my roles is ensuring and maintaining a safe environment for patients and staff. The Dominica China Friendship Hospital is grateful for this opportunity to offer the public some guidance as it relates to visiting the facility and protecting oneself and the vulnerable patients. As you have heard from Dr. Ahmed, COVID-19 infections are still occurring in Dominica, and so we must continue to take every available precaution to prevent contracting and spreading COVID. Although nationally the mask mandate have been lifted, I am sure you all can appreciate that certain measures must be taken to protect the most at risk among us. The Dominica China Friendship Hospital has therefore updated its policy on mask wearing as follows. Face masks should be worn by all healthcare workers while present at the hospital and especially while involved in direct patient care. Visitors to the hospital are expected to wear masks or facial covering while at the hospital and especially while in clinical spaces. All patients seeking care at the hospital, whether inpatient and outpatient, are advised to wear masks or facial covering while at the hospital. All ambulance drivers, EMTs, police officers should wear masks while present at the hospital. It is important to note that currently not all patients are routinely tested for COVID infection. Visitors are also not tested prior to visiting on the wards. This makes the wearing of masks even more critical to protect patients, staff, and visitors, especially on entry to the wards, clinic, and other clinical areas. The public is also reminded that COVID isolation unit is a space providing clinical care for those patients with a communicable disease. This means that visitation is not allowed at the COVID isolation unit. We recognize that during this season, much like during Independence and Christmas activities, relatives will be coming in from all over the world, but our priority is to protect both visitors and patients alike. Therefore, family members can drop off supplies for their relatives admitted to the COVID unit with the nurses at the unit. We wish all a safe Carnival season and continue to encourage everyone to do everything possible to curb the transmission of COVID-19 in our country. Thank you.
Thank you so much, Emmeline Matthew, matron at the Dominica China Friendship Hospital. So bottom line, we're protecting our patients and visitors at the hospital. That means that you also have a responsibility, the general public, to those patients and to yourself. So masks are mandated at the Dominica China Friendship Hospital. And our last presenter this morning is the Chief Medical Officer Acting, Dr. Laura Esprit.
Greetings to the listening and viewing public, including the diasporans on their way home to Dominica. The word on the street is that COVID left. Ipani Sanko. Some ask, COVID is back, right? Wrong. COVID has never left. If anything left, it has been our sense of alertness, not COVID. As a matter of fact, the notification issued by the World Health Organization in March 2020 with regards to the COVID pandemic remains in place. And yes, it applies to the Commonwealth of Dominica. For those on social media who may be wondering why are we now back with a press briefing, for which I am sure there is a lot of speculation about the reason, the answer is really simple. We are approaching the peak of the Carnival season, and the ministry wishes to provide some practical guidelines to the public about remaining cautious while reveling and or participating in mass gatherings of the season. For those who wish to stay clear of the festivities, this approach may likely reduce any potential risk, unless someone who participates brings it home to you. But for others who will partake, not having done so in 2 long years, these tips are especially for you. If you have flu-like symptoms, you are kindly advised to get tested. Be sure that the flu is not COVID. Testing for COVID continues at all health centers across the island at no charge. You do not necessarily have to be sick or symptomatic to be tested. If you wish to know your status, the staff are all trained to assist you, and stocks are available throughout the island to do so. And yes, the responsible thing to do is to isolate at home if tested positive for COVID, at home. Be creative and use costume-made masks that complements your outfit. Be sure that it covers your nose and mouth, and use during periods of mass gatherings. There is much controversy surrounding the use of masks as a barrier measure against COVID. While some may disagree, the ministry is convinced that masks do assist when used as a complement with other social and public health measures. Despite the removal of the mask mandate, consideration to use masks is strongly encouraged for the following high-risk persons based on their jobs, especially with the projected influx of visitors. Workers at ports of entry, customs, immigration, and police officers, persons in the hotel industry, inclusive of taxi and tour operators, street vendors and supermarket attendants, bus drivers and gas attendants, visitors to elderly homes and health facilities, emergency responders and healthcare workers, staff of saloons, barber shops, bars and restaurants, and of course, persons with underlying medical conditions. If I were you, I would actually wear it. But again, the mask mandate has been removed, and we use the words strongly encouraged. For high-risk individuals, including persons diagnosed with asthma, you may want to stay on the sidelines or in less crowded areas. Organized bands can encourage a reasonable distance among their patrons, if possible. Whilst being active partakers or onlookers, practice respiratory etiquette. Cover your mouth and nose with a tissue when coughing or sneezing, and use the nearest waste receptacle to dispose of the tissue after use. If tissue is not available, cough or sneeze in your bent elbow. Walk with a small hygiene kit, including hand sanitizers with 70% alcohol. As soon as it's convenient, wash your hands with soap and water for a minimum of 30 seconds. Avoid sucking on each other's rum flask. Get your own. Avoid sucking on each other's camel pack. So, Sheens, you want to suck? Nonsense. So, bear that in mind that COVID can be transmitted through those objects. Avoid the puff-puff pass or chain smoking, which is a means of sharing COVID-infected saliva or quasha from one user to the next. So get your own bottle, get your own camel pack, and remember, unless a person is visibly symptomatic, we do not know if they are infected. While it's customary to, wave your rags and bandanas, consideration must be given to the possibility of bodily fluids, including sweat and quasha, showering on everyone. Bear that in mind. Avoid the overuse and abuse of alcohol or other illicit substances during the season. Research points to the likelihood of disinhibition or loss of restraint and impaired judgment when under the influence. Hence, you are more likely to touch your eyes, touch others, and even carry COVID home to grandma. Also, stay alert to the sprinklers during the close-up, face-to-face conversations and the koshi, especially when the music hits the right nerve. Children, we didn't forget you. Do not share your food like your lollipop, your hot dog on a stick, even your juices with your friends. Avoid picking things off the ground that may have fallen without proper sanitization. Now, I haven't recalled seeing an 80-year-old gyrating on Carnival Monday. Supli, please do not carry COVID to your elderly parents and grandparents, neither to your children at home. If it is at all possible, have a change of clothes on the porch, on the balcony, somewhere, so that you can shower outside before entering your home. Additionally, it is strongly encouraged to use a face mask in the presence of or when caring for the elderly and the vulnerable after having participated in mass events. any small action on your part is important in minimizing the chances of COVID infections and deaths among the vulnerable. Now, if for some reason you decide to bubble a pot at home or say by the river, avoid sharing utensils among users. So for example, don't do this. Guys, come taste the broth to see if it have enough salt. Please. So proper hygiene, sanitization of items, and disinfection of surfaces remain essential at limiting transmission of the virus. And this also applies to performers who share microphones and other instruments among their users. Parents, on Ash Wednesday and beyond, if your children have flu-like symptoms, please do not send them to infect other people's children and the poor teachers. Teachers are not there to babysit the sick. That's not their role. In these cases, you are fully aware of the measures to implement. And lastly here, recently we had periods of gas shortage, but we've never had a shortage of vitamins on island. Continue to boost your immune system with supplements and the bush teas that we know to work. Don't allow them to expire on the shelf. On this note, the public is informed that the opportunity still exists to get vaccinated or boosted. Please talk with your district nurse about receiving the Pfizer vaccine while efforts are being made to restock with other vaccines at soonest. COVID or no COVID, carnival or no carnival, drinking and driving under the influence, violence in its different forms, sexual promiscuity, and substance abuse and misuse remain public health concerns that we all should guard against. This message is by no means an attempt to scare anyone, but as with everything else, we have to sewer and fet responsibly amidst a pandemic. So don't be selfish. Having witnessed first-handedly the burden COVID has placed on our health system and the economy should move all of us to view our health as a top priority. Remember, frontline workers are still in recuperation mode from the overwhelming 2-year COVID response, whilst you, the public, express your personal and far-reaching challenges when your income and livelihood were impacted. And please remember the 78 lives lost to COVID in Dominica. In conclusion, I implore you to take heed of this proverbial advice, where the shrewd one, sees the danger and conceals or protects himself, while the inexperienced keeps on pressing on, pamely, and therefore suffers the dreaded consequences. Thank you for your attention.
Thank you so much, Chief Medical Officer Acting Dr. Laura Esprit, with the stern warnings but practical guidelines for this carnival season. And we want to thank all of you for being so attentive, also for your diligence over the past almost 3 years of this COVID-19 pandemic. We thank the Office of the Prime Minister for hosting us so graciously, as always, our media partners for always coming on board, even at last notice, to assist us in sending out this information. Our presenters, kudos to you as well for a job well done. Have a safe carnival season, everyone. Thank you.